and thanks for joining us for this edition of the Wellness Connection with Adventist Health. I'm Kiyoshi Tomono, and today, because it is October, the month of October, we are talking about breast cancer awareness. And joining us here today, Jenny Lavers, our extraordinaire around operations over at Adventist Health here in Kern County, and then also at the AIS Cancer Center, Dr. Francesca Hoehne, who's one of our breast surgeons. Thank you guys both for joining us.
Thank you.
Exciting. Okay, so first we want to talk a little bit about, and we're going to brag a little bit, about the AIS Cancer Center at Adventist Health, because I don't think everyone knows what a hidden gem it is and all of the work that's happening there around kind of improving the quality and level of care here in Kern County. So we wanted to show some things. We're the breast center is actually NAPBC accredited. Jen, I'm going to let you talk to us about all these things because you're part of all this. What does it mean to be accredited, not only by NAPBC, but also being one of the programs here in Kern County designated and accredited as a comprehensive community cancer program by the American College of Surgeons Commission on Cancer? It's a lot of words. It sounds fancy, but what is it, and what does it mean?
It sounds fancy. It is a lot of words, but it is fancy. That's kind of the point. So the American College of Surgeons has many different accreditations based off of programs. And so there are rigorous standards that you have to meet to be able to achieve that accreditation. What the AIS Cancer Center has achieved is our breast program specifically is NAPBC certified. So it means that the breast center, all of the things that have to do with the diagnosis, the workup, the actual treatment, all meet those standards and show that we are a very high quality center. It shows that we are meeting the standards of any academic institution across the country. In addition to that, just like you mentioned, so the what we like to call the big kahuna of cancer accreditations is the American College of Surgeons Commission on Cancer, and we have been designated as a comprehensive community cancer program. And so that's every aspect of the program, medical oncology, radiation oncology, breast surgery, imaging, pathology, all of those things go into it, and again, speak to just the level of care being provided.
So I am lying a little bit because I was here for part of that process,
Yes.
and part of what they were also looking at too is the amount of outreach that you guys do, and participating, as you mentioned, in some of the clinical trials and the research trials that are being done. But basically, it's the whole package, right? You are trying to get to folks as early as you possibly can, and then bring them through treatment as early as possible to have the best outcomes.
I totally agree. So essentially, we're saying that not only do we do the right thing, but we want our community to have access. And so we do community outreach programs, screenings, early detection, all as part of that, to show that we want everyone to have that high evidence-based level of care.
Yeah, so you don't have to go out of town. And Dr. Hoehne, let's talk a little bit about the comprehensive nature of the Cancer Center, and what is it like for you as a physician, as a surgeon, to be able to have everything on one campus, right? You don't have to send people, because part of that for your patient, it is a overwhelming diagnosis, and you want them to get all the care, but if they don't know where to get the care or how to get the care, they won't get it.
I think that's a really good point, and that's central to our mission to how to provide care, is to make it accessible and to make it as easy as possible for individuals. So once you come through the breast center, you're kind of part of that family. You meet our nurse navigator, our extraordinary Jackie.
Nurse Jackie.
Nurse Jackie.
Infamous.
And so, yeah, infamous. And so she will take you through the whole process. So you meet the surgeon, our medical oncologists are right next door, radiation is next door. We have social workers, the hospital for your surgery is across the street, the pathologists and the radiologists are right next door to us. It allows us a lot of communication and therefore coordinating of care, taking some of that pressure off that patient, saying, well, where am I supposed to go now? Where am I supposed to go now? And what comes next, and kind of streamlining that for them so that we take that burden off of them.
Yeah, and it's a frightening diagnosis, but I mean, there's so many steps, and it's like they need to be able to follow all of those so that the care that they get is optimal for their outcome.
You're correct.
Yeah. Okay, let's talk a little bit about Dr. Hoehne, some of the myths out there about breast cancer. Katie Couric just recently coming out and letting the world know that she had been battling breast cancer. She, of course, lost her husband previously to colon cancer. She's doing a great job out there, kind of getting the awareness that women need to get out there and kind of get their mammograms. But let's talk a little bit more about the everyday, because it affects men and women. But what about men? Are men getting breast cancer? Is there an increase in breast cancer there? And how many women are getting breast cancer?
So breast cancer, if we look over the years, there has been an increase in the number of absolute cases that are there and absolute deaths. However, we have to remember that the population also continues to grow and age. So we all are having an increase in the longevity, and so the likelihood of cancer is more common. As you know, it's more common in women than men, about approximately 1% of the general male population will have breast cancer. So it is more common in women than in men, not necessarily increasing though.
Okay, so is it maybe also awareness because people like Katie Couric are coming out and talking about it, and women are actually getting screened or screening themselves?
Yeah, and undoubtedly, and if you think about screening's a relatively new thing. It's been very much popularized by, thankfully, people who are becoming large advocates for cancer screening, such as Katie Couric. But also, I think in our community with individuals who are willing to share their stories, and so helping their own family members get screened appropriately and things like that. So people are much more open about talking than they had been in years past, perhaps about their diagnosis.
And I would imagine for men too, a lot of times men either just miss it kind of, or just kind of talk it away and say, oh, it's just a bruise or it's a lump, but it's not, it doesn't happen to men.
I agree, and I think that's part of the, again, education. It's something that, well, I don't have breasts, so I'm not going to get breast cancer. So I think it's just, again, that awareness more in men that a lump can be something. And just to make sure that it gets checked out.
Okay, so how should men be screened, right? Because for women, we know about mammograms. If we don't have breasts, how do men get screened then?
So men still have a little bit of breast tissue, so I think the best thing to do is just to do a physical exam. And if you notice something that seems abnormal, is to see your primary doctor.
So any kind of lump, any kind of discoloration, any of those
nipple
things?
retraction, nipple discharge should be brought up to your primary doctor.
Which is interesting because I think a lot of people assume it's just a lump, but sometimes that sore, which maybe is what a late stage cancer, can actually be cancer. They don't think of the sore being actual cancer.
Just like you said, somebody thinks, oh, I must have hit it, this is just something, I got a bug bite, something else happened. And there's a lot of explaining away of the symptoms. And unfortunately, those are the things that are, early detection will provide survival.
And so let's talk about family history. It plays a big role. It's a genetic component. It's a genetic disease. What does that mean for women if you've had a family history somewhere along the line?
So genetics actually is an interesting place, is in an interesting time right now. So we know that about 5 to 10% of all breast cancer cases are truly genetic. So it's important, and there's a large push now to looking at giving people a risk level and screening for risk. So something that your primary doctor or even some imaging centers will do is to screen you for risk. And so they do ask about your family history. So first degree family history, such as mom, siblings, or children who have breast cancer, increases your risk. Even extended family, aunts, cousins, things like that may increase your risk. We're also looking for associated cancer. So not just breast, but perhaps ovarian cancer, colorectal, gastric cancer that may have different associations, because we know that there's more than just BRCA1 and 2, or like Angelina Jolie, the breast and ovarian type. We have newer genes that are coming out that also may carry an increased risk for breast cancer. So we're also asking people about a wider family history of cancer.
And so what role do genetics play exactly in breast cancer? 5 to 10% of breast cancer is due to a mutation from a particular gene?
Yes. So they estimate that in the general population, all breast cancers, about 90% are not genetically related, 10% are. So again, we screen their family history for any kinds of cancer.
And you mentioned the BRCA or BRCA gene. What exactly is that? We hear it talk about it a lot. It's like the breast cancer gene, but why is that?
So BRCA1 and 2 are one of the initial genes that we could screen for, and so they're mutations within a certain part of the DNA that lead people to a higher propensity of breast cancer. So depending on where your mutation is, your risk can be up to about 80%. And again, that number is different depending on where the mutation is and your age and things like that. So, but they tend to have clusters such as breast, ovarian, and pancreatic, and in men, even prostate cancer.
Interesting. So it's clustered around those genetics that you need to get screened for, especially if you have that family history. Let's talk about size. Does it matter? Because some women think, well, my breasts aren't large. It's a breast cancer. The more the tissue, the greater my risk. And you're saying no.
No.
Okay.
Same risk. Sorry.
And so these women should also be screened as well?
Yes.
Okay. And studies show that they still need a mammogram. What's the recommendation? Yearly for most women? Okay.
So 40 is the general start time for most people. If you have a higher risk or you're genetically positive, you may be needing to be screened earlier. It's every year, once a year for a mammogram, and a clinical breast exam is recommended.
And what about implants? Higher risk?
No.
No higher risk?
No higher risk. However, implants may make mammography a little more technically challenging.
Okay.
And so women just have to be aware of that.
This is what I've heard, antidepressants, or antiperspirants, which are totally different, deodorants, what I should have used, antiperspirants, because it's the proximity to the breast. Does that cause cancer, the aluminum or something like that, I've heard?
Yeah, no, there's a lot of myths about actually aluminum and the fact that if you get nicked when you're shaving, that gets into your system. There's no conclusive evidence that that's actually associated.
Okay, if someone has a lump but their mammogram's negative, should they still be concerned?
Absolutely.
Okay.
Absolutely. Mammograms are approximately 80%, we can detect about 80% of breast cancer. So that's why we still recommend people to do their monthly self-exam and to get a clinical breast exam by your physician once a year to figure out what a lump may be and if additional imaging is necessary.
Okay, let's talk a little bit about the treatment now. Everyone thinks a lot of times it results in mastectomy, chemo, radiation, your hair's going to fall out. Is that the case for every woman, or how does that work?
Absolutely not. Today we have individualized treatment that's really looking at, we have national guidelines, but tailoring each treatment plan to that individual. So there's a lot of improvements that have been made since the mastectomy, chemo, radiation stages, breast conserving therapy such as lumpectomy, oncoplastic surgery, which can be a reconstruction at the same time with the lumpectomy to improve cosmesis. Mastectomy and even implants have come a long way. We've downscaled a lot of surgery. People don't need all their lymph nodes out. We can do sentinel node biopsy with less risk of complications such as lymphedema, which is a large concern for our patients. And then obviously on the medical oncology side, there's Oncotype DX, which is a tumor typing to make sure that, to see if patients would really need chemotherapy, and even not every patient needs radiation therapy.
Do you think we will get to a point where genetic therapy, excuse me, will be an option for women? I mean, you're talking about these huge advancements, it seems like, even in the last 15, 20 years. Will we get to a point where you'll be able to step out that BRCA gene and replace it with a new, clean, non-mutated gene potentially? Is that on the horizon at some point?
Probably.
Okay.
Probably. Yeah. It's amazing what they can do now, and so who knows what the future holds.
I mean, I've seen the machine, right, that's over there that you guys use for radiation treatment, right? And it's focused, and it's literally tracking the person's breathing so that they're only getting radiation exactly where the edge of the tumor is and nowhere else. I mean, that in itself seems like pretty amazing to me, because chemotherapy, right, was this treatment drug that basically went after every cell almost in your body that grows fast, and now we're like laser pinpointing the treatment, which is...
Yeah, I mean, it's amazing what's happened over the last, if you think up a relatively short period of time, in about 100 years, we've gone from taking people's muscles and nerves to doing a lumpectomy. We came from having no chemotherapy to giving every woman chemotherapy to tailoring chemotherapy. We have stage 4 women who have a new life because of medications that are available. So, it's amazing what can be done, and it's important for women to know that breast cancer is not a death sentence. It really is something that can be treated well, so people should not be scared of, and really see their doctor and get their mammograms once a year. And
we're talking about some of the treatment, but what about prevention? Are there things that you can do to avoid getting breast cancer?
Well, you can't really avoid, but you can decrease your risk, and the basics are exercise, making sure you keep your weight down, avoid alcohol, and take your vitamin D if it's low. The American Cancer Society has a great portion of their website that currently looks at prevention and introducing ideas such as cruciferous vegetables in your diet or supplements to help decrease your risk.
Antioxidants, we hear a lot about those basic things, right? We all know that eating healthier is generally the good thing to do, right?
Not as fun.
Not as fun eating all those broccoli and cauliflower. The one thing you can control, which I did see here as one of the risk factors, is getting older. I mean, we'd all love to. But it is amazing, you were mentioning, people are living longer these days. Right. So the chances of getting cancer, I imagine, as we get older in age and are exposed to radiation and all these other things and sunlight and eat bad and all those things, our chances of getting cancer increase, I would imagine, the longer we live.
Yes,
so.
But we also are able to do things that you can
control
increase your risk. Yeah,
we can control some of those things.
Yeah.
Okay, so let's talk more about some of the risk factors for breast cancer. What are some that women need to keep in mind? Being a woman, obviously, one of those. Mm-hmm. Age is another one, and then personal history. What about recurrence, return of the original cancer? How often does that happen?
So recurrence, thankfully, is not as likely. Women, obviously, there are things that we can do to prevent a tumor coming back, such as taking medications or in certain cases chemotherapy. Obviously, that's the whole point. Other things that can increase your risk are patients who've had, again, that family history, a genetic propensity, or people who have some pre-cancerous changes to their cells, such as atypia or a lobular carcinoma in situ.
Okay, so there are some risks that you can deal with, but things to be aware of. As you mentioned, family risk is one of those big ones. All right, Jenny, you've been here the whole time. You've been listening to all this. Let's bring you back in. Let's talk about some of the fun events that we're having over at the AIS Cancer Center for the month of October to raise awareness. That's one of the pieces that we talked about. VI Pink is the biggest one that's coming up.
Yeah, VI Pink, the breast event of the year, as we lovingly refer to it. It is what I like to call Girls' Night Out meets resources and fun. And so we're going to have vendors there. We're also going to be just celebrating our survivors. But at that same time, if you haven't been able to get out and get your mammogram, Quest Imaging will be open in the evening to be able to offer women mammograms. We're going to have shower cards there. I mean, Dr. Hoehne mentioned a lot about needing to do breast self-exams. And so if you need help, if you need reminders, if you need instructions, all of those resources will be there as well.
To give context, it's a card Ray, I'm guessing you put in the shower to remind you how to do it, right?
Yeah, and I mean, I don't know how many times have you driven home and then forgot how you drove home. The idea with the shower card is that you mark off that you did it each month so that way you know and you're holding yourself accountable.
To doing that self-exam, because it's one of the quickest and fastest ways you might be able to catch something.
Exactly.
Okay, and so we're also doing free clinical breast exams, is that right?
Yeah, so the day after VI Pink on October the 14th, on that Friday, Dr. Hoehne, Dr. Gordon, and some of our other breast specialists will be offering up their services to the community. This is really designed to target people who might not have access to care. So if you are in between insurance, if you don't have access, or primary care provider, this is an opportunity for you to have that exam done. If you've been worried about something and you just haven't known who to ask or where to go, we would love to be able to help support you.
Okay, and then finally, of course, in the month of October, there's a cash rate, so to speak, for mammograms.
Yeah, absolutely. So Quest Imaging is offering 3-day mammography for $89. It's open to anybody, and again, it's really about just making sure that you're getting your annual mammogram.
Okay, and there's the numbers we flashed on the screen up there. For the mammogram number, it's 661-633-5001. If you're interested in the clinical breast exam, 661-863-2001. And then, of course, for VI Pink, we'd love to see everyone out there if you'd like to RSVP. We're trying to figure out how much food to buy. It's 661-863-2209. And then one of the other things, if you have any questions, we went over a lot of information today. We want to encourage women or men, if they have a question, to reach out, right?
Yeah, absolutely. I mean, all those accreditations that we talked about in the beginning, they really just symbolize what we stand for, and that's for our mission, which is to help our community. And so if you have any questions, if you don't know where to turn, the phone number for the Cancer Center is 323-HOPE. It's easy to remember, and we're happy to help answer any questions.
All right, 637-8720 for the Breast Center as well. If you guys have questions, any of those, we want to make sure that people are getting access to care. If they have a question, that they're getting seen, because well-being is super important for everybody.
Absolutely.
All right, and thank you guys for joining us here again for this edition of the Adventist Health Wellness Connection. Dr. Hoehne and Jenny, thank you guys both for coming in. And again, if you have any other further questions, you can also go to our Facebook page, our Adventist Health Bakersfield Facebook page. You can ask a question there, or of course, give a phone number, give a call to those phone numbers. And if you have any questions about those events, they're also posted on that Facebook page. Thank you for joining us, and we'll see you again next time. Stay healthy, Kern County.
Thank you.